Hi, my name's Jackie Brown from Bums, Tums and Gums. About 7 years ago, I went up to Thailand and had a facelift and upper and lower eye lift, and I was about 57 then. Yes, if you got your maths right, I'm 63 this year. So I've worked in the travel industry for probably 25, 30 years now, and it was always a dream of mine to go and get surgery as I age. It was not a matter of if, it was always a matter of when. So I did a lot of research, and so this is me going independently. I went up there with my husband, had the surgery, did a lot of research on all the surgeons, loved their work, came back, and I was just over the moon. I was over the moon with the face, how it all come out. I was over the moon with the cost, the facilities, the surgeons, and the care I received while I was up there. So from there, a few friends said, can you take us in a small group? And that's how it all started. Started taking small groups of women, got bigger and bigger, and now I do cap my figures to 12 people, because for me to give you quality, I like to take groups of, say, 12 like-minded women, and I shouldn't just say women, I've had gentlemen come along as well. So you might be saying, well, what do guys have done? Well, the most common one for a man now is actually, as they're aging, to get the upper eyes lifted, or a whole face lift. This is for the older men. I must admit, most of my clients would be over the age of 50, and the most popular one, I suppose, would be tummy tucks, and I think facelifts when we get a bit older. And I mean, a facelift actually is, they redrape the skin. They redrape it behind your ears, and they do the upper and lower eyes. So they'll be the most popular, of course, breast augmentations and breast reductions. I mean, we do a lot of different surgeries up there. So I go take groups up there about 4 times a year, and we leave from Auckland. We go up there for 2 weeks, stay in a great hotel. The staff are just awesome. I'm with you to, I don't know, whether it's just to take the dribble off your mouth or bring you a smoothie when you feel like your throat's sore from the anaesthetic, whatever reason, I'm around. When you start feeling a little better the second week, we're off to the tailors, or it might be, come on, let's go for a walk down the beach. Let's go to a ladyboy show, and we all go as a group. Now, that's not to say you have to come as a group. Some of you would like to go with husbands, daughters. You can do that. Everything's still organised. Broker. So my job is to organise your flights, car to pick you up at Bangkok airport, takes you down to your hotel, which is in Pattaya, which is 1 hour 40 minutes away. The hotel's ready for you. Take your bags up into the hospital for your pre-ops, and then next day you're having your surgery. So you can go independently and do your own thing. You'll need to allow yourself 2 weeks. If you're having multiple surgeries, give yourself, I would always say, 3 weeks. As the saying says, bums, tums and gums. So we do dental. There's a whole floor there just of dentists, and they are amazing. In the waiting room, when you see your surgeon, you'll see people from all over the world. So it's not just New Zealand. They deal with Australians, lots of Russians, Europeans, Americans, British. I met a lady from California on the last trip, and she said, you know, I've come all the way from America just to see these surgeons because I have done my research. She said, and these are the best surgeons that have come up on all of the Facebook, all of the forums, everything, and that's why I've travelled all this distance. I had a lovely story last week. My group of people, we all have a reunion every so often, just to see how things are going. And one of the girls there said, I've actually showed my surgeon here, and he actually is a plastic surgeon up in Auckland. I had a chat to him, and he said, why didn't you tell me you were going to Thailand? And she said, it's because I thought you might scaremonger me. He said, you're kidding. He said, where do you think a lot of us surgeons do our training? Many of us go to Thailand to do our training. Then he said, let's have a look at the work. Had a look at the facelift she'd had done. Said, some of the nicest work I have ever seen. It's fantastic. So don't let people go, oh, don't go to Thailand. You know, you hear all these horrible stories. Yes, you do. But is there truth to them? Some countries, I will only use a hospital, not a clinic, not a little rented room in a hotel, a huge working hospital with paediatrics, cardiologists, everyologist. They have everything going. I mean, we've got 15 floors of wards. We have a whole block just for surgery, for plastic surgeons or restorative surgery. So don't be afraid. If you do feel anxious, I'm always there to talk to you. I'm going to start doing these vlogs every couple of weeks because I have more time to do this than I do sitting there writing. And I'm not great on Facebook because I have other jobs as well. I teach, as some of you know. I'm actually a lecturer in tourism and I've been in the travel industry for, as I said, 30 odd years and have worked as a broker. I'm not a doctor. Hey, please don't start emailing me with your questions. I'm not a doctor. I know that much, which is probably more than you know at this much, but I don't know that much that the doctors can tell you. So I will never, and it's a dangerous line to play. So what I do is I send your photographs up to the surgeons, I chat to you, I can take your anxieties away and give you advice, absolutely. But let me know and see what I can do to help you. And don't be afraid. It's a big world out there. Take a big step forward and you will not be disappointed. Thank you.